be a syndrome. Hahnemann suggested this particular relationship between dermatitis, rhinitis, and asthma in 1750s. The modern medicine is accepting that only recently. Now they say it's all one common allergic response, and there is a common factor that underlies this response of an individual. These things were collectively called by Hahnemann as psora, or an affection of psora. So psora is the itch, but it would then manifest in many different ways. And this eruption, if it is suppressed, it would then go and attack the nose and create this kind of a allergic rhinitis or sinusitis, and then it would progress deeper and cause bronchitis, which would later become asthma. And it happens to many people. They just suppress the eruption on the body, and then it travels inwards. If you know the Herring's law of cure, the law of cure is from above downwards, within outwards, and from the more significant organs to the less significant organs. This is the direction in which the cure happens. But the law of disease is the opposite. It's from less significant to more significant, from below upwards, from outwards, outside, to within. That is the law of the disease. So the disease usually starts from the most vulnerable, but at the same time insignificant organs. Our body, I'm talking about those diseases that originate from within. I'm not talking about sicknesses that are as a result of some mechanical thing that happens to our body, or accidents, or poisoning, or something related to vaccination, or something from outside, an outside agent affecting us. I'm talking about those diseases that come from within. Now, among these diseases, there are acute and chronic diseases, and acute diseases have a different origin. They affect all people, and they are caused by the causative organism, which has the tendency to suppress human immunity, or to fight and defeat human immunity, regardless of which person gets it. It has a strength that is much more powerful than the chronic disease causes. But the chronic disease causes are the ones that kill people eventually. Now, what do we call these chronic disease causes? We call them miasma, or chronic miasms. So there are acute miasms, like certain acute infectious diseases, and they need to be treated with a different emphasis and in a different way in homeopathy. But the diseases that originate from within, they are the chronic diseases, and these chronic diseases are caused by chronic miasm. Now, this has a subtle way of attacking the person. It starts, so once our immune system is weak and the inner man is weak, the body gets affected by this causative agent of sickness, which we cannot see with naked eyes. It cannot be seen with a microscope also. It is not some bacterium. And what happens, it is a certain thing that creates an abnormal response. Usually these are all allergic. And this abnormal response is the reason why people get it first. When they get it first, our body just throws it out into the most insignificant parts of it. Like skin is the most insignificant in the sense that it is a part that is noticeable, but at the same time, even if skin gets affected, the person is not going to die. But if the sickness affects vital organs like brain, heart, liver, or kidneys, patient's life can be compromised. So the body usually tries to get rid of that sickness by pushing it out into the parts that are less significant and less likely to kill the body and more visible to the conscious person. So for us now, if you have an eruption in your body, it is visible, and we know it is not so significant. It's not going to kill you, and you get significant time before the body takes a deeper course, or the disease takes a deeper course. So you have the time to cure it. The body is bringing this to your light. When this comes as an eruption, if you treat it according to the law of cure, which is similia similibus curenta, which is like cures like, if you give them the right substance in the right power, right quantity, and the person responds to that remedy, then this sickness can be cured from within. This allergic eruption would go away completely from within. But if you suppress it with some sulfur ointment or any other ointments of the modern medicine, next time you would get a more severe manifestation of it, or you may even get a rhinitis or asthma. And when this happens in people, modern medicine now has a name for it. It's called atopic triad. But it can happen in many different ways. For some people, the same skin eruption would go away and then be followed by gastric symptoms. And what are these gastric symptoms? Symptoms of GERD, symptoms of gastritis, gastralgia, all those things would come. And then this collection of symptoms would be called as irritable bowel syndrome, because you cannot identify any pathology. There is nothing happening. It's allergic. And we do not know why this is happening. So eruption, dermatitis is followed by some gastric diseases. The collection, when we cannot pinpoint the reason or the cause of it, we would call it the collection of symptoms. We would call it an irritable bowel syndrome. It would be constipation type or maybe diarrhea type. These are the cases that come to homeopathic physicians generally. And sometimes the same thing can happen to the joints. Now, some people would say, well, it is a gout. Some people, it would be an arthritis of unknown origin. Sometimes there are so many different kinds of arthritis these days, and they would call it reactive arthritis, this arthritis, that arthritis, rheumatic, whatever it is, depending upon the apparent cause that we find in our laboratory tests. But if you go deep down, if you take the case properly, you will find that these people would have some history of these kind of manifestations which came in their body before they got this arthritis. Many a times, I've seen people having something to do with STDs and all those things before they eventually end up with some rheumatoid problems, rheumatological problems. And in other cases, it is just this kind of a itch or some chronic tonsillitis, which could be seen to develop into this. Now, if it is chronic tonsillitis, then we would say, oh, well, it is rheumatic arthritis. A streptococcus and abnormal response to streptococcus is the reason why this is happening, and the ASO titer is high, and we would diagnose it as a condition, as a as a syndrome, but we do not know after that what to do. We do not know why this is happening, why these abnormal responses are happening. As I said, immunity has a healthy way of responding and has an unhealthy way of responding to sicknesses. And the healthy way of responding is the original way with which we are born. When we meddle with the immunity too much, using antibiotics or using these external ointments and creams, what happens? It then starts giving out some unhealthy ways of handling the sickness. And this usually happens in the chronic cases. So it may not happen in a person who is suffering from an infection of Vibrio cholerae or streptococcus, something that has caused him a pneumonia. These are all acute diseases, acute causes, which have a course that they take. Sometimes it ends with the patient's healing, sometimes it ends with the patient's death, whatever be. All acute conditions, they take a particular case, like a story. There's a build-up going on, and then there is a climax, and finally there is a decline of that patient. So many years ago, my cousin, he taught us how to draw Gandhi. So all he said was like, you just start here, and then you put it like this, and then put the goggles in the middle, and it will be a Gandhi. So it's like that, The disease would start with a prodromal state where nothing is manifested, and then there will be a slow development and the progress, and then there will be a climax where the patient is extremely sick, and anything can happen. The patient can heal from there, the patient can die from there, and if not treated correctly, the patient will decline and die. And this happens in stories also, right? There is a build-up of the story, and then there is a climax of the story, and then there is the end of the story. So there is a beginning and an end, and there is in between this build-up and climax and all those things. Now the point is, wherever there is a reversal of expectation, that is what decides the beauty of the story. Now, in many diseases, there is a reversal of expectation that happens. Now, we expect it to progress in a certain way, but it goes in a completely different. It takes a completely different route, and this is what helps us to individualize the patient. So, not in all patients, not in every case of that disease, would manifest in a like manner. So, for instance, now I have high fever, and everybody expects me to cover myself and turn off my fan and AC and everything. But suppose I feel very hot. I remove all these things and I want the air conditioner at a very high speed. I want my fan. It is a reversal of expectation. When people come, they see me, they think that it is not appropriate. Maybe I'm not responding in the right manner to my fever. Or maybe I should not do it, but this is what gives me comfort. For some people, they have a burning pain in the throat, and then they are craving for hot drinks. You have a burning pain, man. How is this burning pain relieved by hot drinks? We don't know. And that's what happens with arsenicum. That's when we see, oh yes, there is a reversal of expectation. It's a very different condition, and we take that into serious consideration to individualize the patient. So suppose we have 2-3, I'm just giving you some examples of sore throats. So you have a patient who has a sore throat, and we expect the slight fever, we expect the patient to be in a certain condition, we expect them to turn off their fans and air conditioner and to maybe cover themselves up a little better. Maybe they could use a little warm drinks, and this is what we generally expect, right? But you come to a place, the patient is in this condition, but they are very anxious and very weak, and they feel that they might die. They tell you that. They are so anxious. It's anxiety out of proportion to the condition. And they have a sore throat and you ask them what's the kind of pain that you have. They say, oh, it's a burning pain. And you ask them, what do you want?